Haemorrhoidectomy under spinal anesthesia. Postoperative orders. Injection ampicillin 500 mg IV 6th hourly after skin test. Injection gentamicin 80 mg IV PD. Injection metrogel 500 mg IV 8th hourly. Injection ranitidine 50 mg IV PD. Injection dicloran 1 ampule IM 8th hourly and SOS. Injection tramadol 50 mg IV HS and SOS. Injection Emicet 4 mg IV SOS and HS. Intravenous fluids 2.5% dextrose and 2 DNS. The foot end of the cord to be raised. NPO for 6 hours. Foley's catheter if needed. 4th hourly TPR and BP chart. Removal of the pack next day. Sitz bath from tomorrow. Smooth ointment locally and capsule Caldope 500 mg TDS. This is an order which has been written for a patient by me some years back, and I would like to suggest that if a junior doctor or a medical personnel is using this as a protocol or a guideline for post-operative orders, they may write it or even read it to a senior faculty or the operating surgeon and confirm the orders, and then only proceed with the prescription. Because the antibiotic regime may be different from institution to institution, as well as the analgesics and sedatives may be of choice of the surgeon as well as the anesthetist. Then the fluid regime may be different. Then other nursing methods or techniques which I have written in this may differ from hospital to hospital. The foot end of the cord is to be raised is dependent on the medicine which has been given as the at the time of spinal anesthesia, and that should be discussed with the anesthetist. NPO for 6 hours or 4 hours is the decision of the surgeon. Few people put Foley's catheter as a routine procedure for all hemorrhoidectomies, but in many of the centers it is done after assessment after a given period. Then the pack usually given with a Sofra tool covering which is put into the anal orifice is also the choice of the surgeon. Many a times a simple pad is kept in the help of a T-bandage, and sitz bath and other things are all the surgeon's choice. So you may go according to the prescription or the senior faculty and take up this procedure. Thank you.